So, Dr. Tano or Dr. Burgess.
Hey, Bill.
So,
Hi.
am I persona non grata after my little meltdown on Saturday?
No,
No,
a
no,
beautiful thing, man.
Hmm?
no. You told the truth.
Yeah.
Yeah. Yeah. I mean, I understand, John, you haven't been well and all, but the rest of them, uh, so we've rejiggered the schedule so we don't have too much open time. So
Good. And you and I need to have a talk sometime, kind of personal and only just us, because I want to talk to you about some money stuff, but I don't want people to know the business. So have a talk with you sometime. And are you planning on voting for a board or anything? Doing any board activity there in Reno?
board activity, yes, I'm hoping somebody will vote me out so that be done. Let
that's
let's
that's
let's
what I
let
was hoping.
somebody else have this joy.
That's exactly what I was thinking.
I
So I
think
know Dr. Nario
I
is
think Dr. Nario would be the perfect person for this,
yeah.
Yeah.
and I think Dr. Tano would also be the perfect person.
Well,
Yeah.
no.
Hey, but we have to have a DO. Oh, that can be our buddy in Nevada. We do have one osteopath, right?
Where's that?
Oh gosh, my brain, Bill. Who's singing at the meeting?
Oh, well, we have more than one.
No, I thought you only had one singer plays guitar. He's our buddy. What's his name?
Oh, Bruce?
Doc,
Yeah,
Bruce.
Bruce. Bruce.
Yeah, Bruce Vaughn. Yeah.
So he's
What am I, chopped liver? I still have a DO degree, they didn't take that away from me. They took away my medical specialty, but they didn't take away the DO yet anyway. I think they're working on it.
Yeah, I shut down my business after 40 years, but I kept my DEA and my medical license. So if anybody needs it, we can use it.
Nobody can use your license, Dr. Burgess.
Yeah,
I wish it was transferable. You can change it and give it to somebody else, but you can't.
could be an idea.
Dr. Tano, I'd be more than happy to hand it over to you. I'll hand it over to you the way it was handed to me.
Well, yeah, so you made me go do the research one, but so
Yeah.
Dr. Nario takes on this one.
Yeah. So, um, well, fortunately, we have a little bit more money. Well, we'll see. We'll see what'll happen after the end of next week. We see if we have anything left. So, we have a lot of sponsors actually. We got 3 new sponsors today.
Interesting. That's cool.
It'd be nice to have more attendees, but we got 3 new sponsors today.
Yeah.
We got
In fact, I
So,
think somebody's bringing,
cannabis,
huh?
cannabis parties there.
No, 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 no. I don't know about that. That'll be private. Somebody's bringing, I don't know, somebody's bringing some sort of
c'est bon.
anti-gravity chair or something.
Suivre ça, c'est bon.
Oh, nice.
So I don't even know if we have room for it. So
Oh, we'll make room.
I said we'll make room. They want to bring.
That's probably me, although it's not an anti-gravity chair. It's actually a
I
light.
can't think of what it is exactly. It's what
I know Mike
it's
is
what
here.
it's what
He's
it's,
got
it's
the one.
it's somebody from Florida. Is that you?
Is that you, Mike?
See, so but I know she was the one talked to somebody about getting some chairs, space for the zero gravity chairs.
Yeah,
So
I think that's it. Zero gravity. I don't know yet. My by this time of the night, my brain is a little famished. So, um, if you don't know what that means, it's mixed up. So,
What about our entertainment? Is that
I'm still it's still pending. So, no,
Hey.
Friday night's all set.
Oh yeah, yeah.
Friday night's all set. Thursday night, I'm hopeful.
You're not gonna do your monologues? Like
I could do I could do jokes. I
yeah,
could do that, right?
but your acting class to
For
use.
this crowd, I mean, I'm really good at lawyer jokes, so that's kind of my specialty. So,
Hey,
uh,
I want to throw something in just because we haven't said it for a while. Twice you guys mentioned you had a morning without breakfast.
I think that's filled in.
Then I talked to Gino and he was willing to help. And I think Melvin, you were going to talk to him. He just wanted to know what you want. He can give you good food. Just tell him what you
No,
want.
no, we have the breakfast. We were talking when I say without breakfast, that means we didn't have a sponsor. So the sponsors are going to be the breakfast are going to be doing 30-minute non-CME
Okay.
non-CME talk. So talk about their businesses.
Dr. Bill, I forwarded you the menu for Grateful Gardens already. So I mean you can definitely look at it and let's decide.
All right. Don't we need to go over there and try it out?
I don't know if that was part of the package, but I can ask.
All right.
So,
I just got a message from Kevin that Thursday morning there's still a breakfast is still open for a vendor.
oh, I thought that was gotten by David Kahn.
Okay. Let me get back to him and you let the folks in. Okay.
Okay.
Is Stefan here yet?
Let me see.
I see him.
Yes.
More importantly, is mom around?
Yes.
You
Oh,
promised.
there's mom.
There's mom.
How's she gonna do pull-ups there?
We weren't going to let him, we were going to have him on. We've had him on enough, mom. But when he said that you were going to come on, that was the hook.
Oh, good. I like to talk.
Well done.
That's why everybody's here for mom,
Yeah,
not for
that's why
Stefan.
we're here. We're here to hear mom. So you're just the moderator, Stefan. So
Testing. Okay, there it is.
mhm.
See if you can hear it.
You have like a full-on
Wow, look at that. You got
Testing,
a
show there.
full-on studio
Testing.
there. You're serious about this, huh? You
Oh,
got,
you
It's a
bet.
nice
you
studio.
got the neon
Oh,
there.
I hear myself. There we are.
You can hear yourself?
Yeah.
We're trying different.
All right, so we got So we
Something down there. No,
Saturday we have David
yeah, give me that one.
and Thursday.
All right. See if I can actually hear myself. Testing. Oh, that's way better. Now I can hear myself. Yeah. How do you like this studio, Clearfield?
It looks great. I mean, you are what I had hoped to be 30 years ago and never got around to doing it. So you're like the living embodiment here. So I had all these great ideas and they never got around to it. Look at that.
Yeah, we look like we're doing this in our garage, and he's like in.
I got my
Reveals.
Philadelphia Eagles thing covering my back door here. I mean, so and you got
We tried.
and Melvin, you have a green screen. So
I know.
Yeah,
I'm hiding
I'm
the
trying
glow.
to trying to increase the quality of our recordings here. I'm going to try to record on the computer here, and then I'm going to record separately on a camera. I'm going to record audio separately.
Stefan's running his own TV studio there.
Yeah, that looks great.
That's right. I think who wanted to do this? It was Harshfield or somebody wanted to create a studio, or Mike Bomer. People have been talking to me about this for a long time. Yeah, you got to have a studio. You got to increase your production quality.
I think our lighting could be better, but
What would you like with the lighting? I can reduce the intensity if it's a little bit too
Are
hot.
we washed out? I'm not sure if you can.
I can zoom what's in here. Hold on, let me zoom in here.
Hey, Stefan. Richard, how are you?
Hey.
You have to center the camera. You're
Okay.
off center.
That's true.
He goes to center.
Yeah, mom needs to move over just a little bit to her left.
Of this
We
plant.
get the full iron, thing, in its all its glory. But if it's too much trouble, Mom, leave it alone. Don't worry.
I was just moving this plant.
No one's going to notice anyway. Right?
Better.
You know the frozen snowball theory?
Yeah. I have fun to
Right?
record.
I mean, it looks great, but you notice frozen state. So we moved Mom over just a hair, so it's
I moved.
it's even.
That looks perfect now.
Yeah, right. But you know what the frozen snowball theory is, right, Stefan? This came from Tim McGraw's father, who was a baseball pitcher for the Phillies. In 10,000 years, the sun's going to burn out, the earth was going to freeze up, and whether Stefan's mom is perfectly centered in front of that neon sign probably won't mean a hill of beans at that point. So
It's a nice sign.
so that's the frozen snowball theory.
We might do a little screen share as well tonight.
Okay, so let us
reviewing some of the things to give us a little bit of a guide.
So are we going to do our little introduction here with Dr. Nario? Do you have your
Yeah, sure.
week here?
Okay,
So
let's get it on so we can get the show going. Okay, so today we're taking a quick peek about our important, or maybe an important dive into something most clinicians completely miss. So vitamin D doesn't just support bones, immunity, and mood. It also acts as a CYP450 enzyme inducer. So our favorite nonchalantly we give to our patients healthy supplement might be quietly altering how their prescription medications behave, especially for the ones who are taking polypharmacy. So here's what we know. So vitamin D activates the vitamin D receptor, VDR, as we call it, then upregulates multiple CYP450 detox enzymes, especially these are just jargon numbers for you guys, but 3A4, 2C9, and 2B6. So these enzymes metabolize more than 60% of all prescription medications. So when a patient increases their vitamin D from low to optimized, which we always like in integrative medicine to around 80 or 90, or starts high doses of supplementation, the liver can clear certain drugs faster. Essentially, the vitamin D says to the liver, hey, wake up, buddy, let's clean house here. So when CYP3A4 or C9 gets induced, serum drug levels can drop, and sometimes that's the problem. So drugs that usually gets affected, statins, especially atorvastatin and simvastatin, so it will be having a faster clearance and reduced lipid-lowering effect. Calcium channel blockers like amlodipine and diltiazem may lead to reduced blood pressure control. Benzos, midazolam, triazolam, patients may feel they don't work anymore, and steroids such as prednisone enhance metabolism, thus reducing the anti-inflammatory effect. So these are the dangerous one, anti-epileptics. Phenytoin, carbamazepine, vitamin D lowers drug levels, while these drugs lower vitamin D, so a perfect storm. So, and also some HIV protease inhibitors, vitamin D may reduce therapeutic levels. And also the old drug warfarin or the rat poison, and 2C9 induction may induce INR problems. And in our hormone world, oral contraceptives, such as ethinyl estradiol based, they actually lower down their efficacy when you have high levels of vitamin D. So clinical pearl here is if the patient is in a narrow therapeutic index medication, always reevaluate dosing when vitamin D is increased or corrected. So most CYP-inducing effects kicks in when levels rise around 40 to 50, and especially when patients take high-dose supplements such as 5,000 to 10,000 international units per day. So this is what we do as integrative medicine doctors, so we need to watch out. That doesn't mean vitamin D is dangerous. It means we need to think like pharmacologists. So a study of Brzezlowski et al. Osteoporosis 2012 demonstrated functional CYP3A4 upregulation once 25-OH vitamin D levels normalize above 40 nanograms per mils starts to show these specific effects. So when optimizing vitamin D, check drug interactions if the patient is on any CYP3A4 or 2C9 metabolized medications. reassess symptoms or drug efficacy after increasing vitamin D, and also document changes in blood pressure, sedation, INR, and lipid levels when you're on these specific medicines. So remember, vitamin D is not just a sunshine vitamin, it's a tiny biochemical DJ remixing your patient's medication playlist. If something suddenly stops working, don't just blame aging, blame CYP induction. So vitamin D, we like it to be used as like a Swiss Army knife for everything, but watch out for these specific conditions.
Okay. And last week at AMMG, we heard about, I think I might have mentioned it last week, the Coimbra protocol where they use
Yeah,
really high
high
dose
doses of vitamin D.
for autoimmune disease. So
Yep.
I'm still doing some research on that one. So maybe we'll have a talk on that somewhere along the line too. I've actually made contacts with a lot of new speakers coming up in the new year. So we're going to
Oh,
have
nice.
some exciting new things to go on. But should I talk about the conference now or just let Stefan do his thing? So real quick. We are 9 days away from the Congress of Medical Excellence for 5.0, and we need you here. The schedule's been rearranged a little bit so that we have some more in-house speakers. You know, those who are regulars pretty much know everybody: Dr. Schallenberger, Dr. Halassa, Dr. Zvinia, Dr. Quinn, Dr. Nario, Dr. Burgess, Dr. Thomas Levy will be speaking for 3 hours on the only cause of disease. He's a classic homeopath, as is Dana Ullman. And on Saturday, we have a couple of other speakers that are. I have 2 new ones that have come on board, and we'll get their bios up as soon as possible. Dr. Gersh, Dr. Swadan are 2 giants in the hormone world, and you would pay a lot of money, $2,500 for a weekend to hear them speak, and we have them for a lot less. We need people in-house in Reno, and it's also online. 20 AMA CME credits, and we usually have a good time. It's kind of the old gang getting back together, and we really need you to step up, everybody to step up and participate. The online, if you're far away and you can't make it into Reno, online isn't that expensive, and it really helps us out. So please, before you sign off tonight, please sign up for something here, and because we're getting down to the home stretch here, and tomorrow we're doing our practice run through at the hotel for advanced homeopathic assistants and nurses. It's only $199. Students 90 and interns 95, military 295, lay people 295, retired physicians 395, and a little bit more for other physicians. We have one sponsor breakfast still available, and that is on Thursday. And if you have things that you'd like to display, so please support us, because we've been doing these Tuesday night conferences since October of 2020. We've never taken a cent, although it does cost us in time and treasure, and a little bit in money, especially for the Zoom. And you've been getting a lot of great content. If you're doing the AMAC credits, that money does not go to us. So we've actually earned nothing in the last 3 years. So please support us. And with that, we have a real treat tonight. So I'm really looking forward to this. So Stefan Hartman, anytime he talks, he gives us a talk. It's always interesting. There's always new information, and he's such a great practitioner and a great just a great human being. But tonight we have Stefan's mom, and they're going to talk about we're going to talk about longevity, right? And we're going to see it in person. So this is called HRT, ice plunges, omega-3s, and dead hangs. Very interesting. That saved me. Now we're saving doctors. Where's Dr. Halasso when you need him? He's not on
I
today.
know he talked my ear off for 3 hours last night. I was hoping he'd join this one.
Yeah. Okay. So
Yeah.
Stefan brings a lifetime of holistic living, elite athletics, and frontline clinical experience to his work, helping patients and now physicians reclaim their health. He's the lead clinician at Iron at DPC and the featured speaker for this week's AOSIM webinar. Stefan was raised by holistic parents, and there's mom right there. He grew up in a home where Chinese medicine, Tai Chi, and natural approaches to healing were the norm, which is way different from where I was brought up. I'll tell you, I was brought up with the opposite. To this day, he has never been treated with an antibiotic. He did not receive routine vaccinations until he entered the university. He's passionate about performance and resilience. And from age 7, he trained and he competed in European junior tennis circuits. And when he moved to Florida at age 15, he was on the U.S. Tennis Association junior and men's pro circuits. He has coached tennis since he was age 15, including high school teams. He blends mindset, movement, and meticulous attention to recovery. He attended the University of Central Florida, where he led the club tennis team to 2 national championship appearances. He worked in the emergency department as a scribe. He graduated magna cum laude in 2015 as a bachelor degree in sports and exercise science. He continued on in the ER full-time. He was a master trainer at LA Fitness. From 2016 to 2018, he completed a physician assistant program at Bay Path University in Massachusetts, and he's practiced in urgent care, internal medicine, spine surgery, interventional pain management, family medicine, and psychiatry. We could go on, but I'm anxious to hear from Stefan. And could you give a little background about mom and all and her journey here? And then take it away.
Yeah, go ahead, Mom.
I can talk about that. When I met my husband in Munich, my dad is German, and I was a German citizen, but I hadn't collected my passport yet. I have it now. So I'd moved to Munich, and I met Thomas, and he had different health problems as a child. So he became macrobiotic, and I started dating him, and I ate the brown rice. I don't know anybody familiar with macrobiotic.
Probably not.
It is a very extreme diet. I would not recommend it for people.
Been there.
But Stefan had to eat quite a bit of it.
I had to go through that phase.
You eat a lot of brown rice and a lot of vegetables and maybe about a tablespoon of oil a week and hardly any protein. And when I tried it as a young woman, age 22 or so, I liked that you could eat all you want and not gain weight. I thought, why is anybody anorexic? You can eat, you can be full constantly, but it's impossible to gain weight on it. It's not really healthy, but then again, it is such a shock to the body that you're trying something extremely different. You are getting a lot of iodine. I found out much later with Stefan, but with all the nori and the arame and the hitziki sea vegetables you eat, being macrobiotic.
It's high iodine.
It is high iodine. I give it that. And there was a lot of fiber, and it wasn't the German fast food diet with, if you're a college student in Germany, you're going to eat a lot of that. And it certainly wasn't the American diet. So
Always, what food did they eat that caused the illness? And that's contrary to modern medicine completely, right? We think diet's completely separate from a runny nose that you might get or an earache that you get. But in the way I was raised, the earache was directly correlated with the food that you had given the child to consume.
Oh, yeah. In Chinese medicine, you can cure vomiting.
Right.
You go pick up some French fries. It has such a downward pulling energy. The upward energy, it's not a cure. Something caused the vomiting that you should have avoided. But since it's there, those heavy fried French fries, all salty, bring the energy back down. So that's the sort of thing Stefan was raised on, the yin and the yang.
The yin and the yang.
The Chinese medicine, traditional medicine. Now, there
But we don't do that anymore. You found something better. And that's the point is through all these years of trial and error, we did macrobiotics, we did Gerson, we did
anti-inflammatory diet.
anti-inflammatory diet. Did we do alkaline ever? Some people talk about that here. You can talk about that too a little bit.
That was very big in the macrobiotic diet, but I mean, I don't want to go in that. Just say that we tried many different things, and I found that I certainly need the B vitamins that come from the natural sources like liver, even the methylated B vitamins that Stefan recommends for me. They're pretty good. Nothing like having oysters or liver.
Beef liver.
It must be the nutrients in there that help. Not sure. It's better.
The body perhaps can recognize the B vitamin a little bit better and absorb it.
Yeah, you see your pee is bright green on the B vitamins. So is your body using it? Probably not. If you eat a lot of liver, it also turns somewhat green, but nothing like a vitamin. So you just can see that's also a Chinese thing, looking at the quality of the poop and the pee, what you've eaten and how it's affected you. So yeah, there's nothing wrong with the yin and the yang of traditional Chinese medicine, but macrobiotics is not traditional Chinese medicine. It was something else. It was just a kind of an extreme diet.
So you found that your brain works better on super high omega-3. We were just at the conference in Italy, which we forgot to give an update on that. And it was a lot of talks about omega-3s pretty much almost every talk came back. Maybe that's because that's the big tool that the Italian dietitians have is to leverage omega-3 because they can't prescribe HRT. But we learned about how important it is.
Well, I have a lot to say on that. Back when we did the Gerson diet, forget which we were taking a high omega-3 linseed oil, well, one of the oils, and we also took fish oil pills. I never noticed anything with processed fish oil pills or with the different
liquids like the drinks, the cod liver drinks.
Yeah, I've purchased the most expensive cod liver oil drinks I could find. Nothing like actually eating fresh Spanish mackerel. So let me talk about it a bit. If any of you just go on YouTube and look up how the processed fish oil pills are made, nobody's putting ice on this fish because it's eventually going to be turned into oil. So it's just sitting around unheated. Then they heat the fish and then they bleach the fish, and then they blanch the fish to remove the fishy taste from the oil. Omega-3 is fragile. We learned that from Dr. Paolo Conforti, who was here, and I can agree. I guess something still survives in the fish oil pills because research shows that it has benefits.
Yeah,
I suppose so. But when I first tried Spanish mackerel, I went out and bought a fish necklace like I had joined a new religion. It made me feel so great, hitting the brain. And all this summer, when I couldn't obtain Spanish mackerel, I bought king. It always seemed available at the fishmonger. And I said, the king doesn't work. I'll give the king a 70% of what the Spanish mackerel does. I found out later all the king is frozen. That's why it was always available. So omega-3 also has trouble holding up through the freezing process. So when you buy previously frozen salmon that's real expensive, we're talking 40% of what you get from something fresh. Very difficult to get the Spanish mackerel fresh because it's a cheaper fish. Once again, they don't want to put ice on it. People have tried it and it was gamey and it was old and the eyes were cloudy. So your fishmonger is your friend. I'm still battling to get a steady supply of it.
Right.
Canned herring and canned herring, the FDA allows them to put trisodium phosphate on canned. Well, actually, the FDA allows trisodium phosphate, which I've used to clean my fireplace. They allow fishmongers to put it on all types of fish, but they tend to only put it on the cheaper fish. So I have a strong reaction to TSP. It's not healthy. They shouldn't do that. And of course, I don't know how the omega-3 doesn't hold up under the canning process anyway without putting TSP on it.
Yeah, you have a very good omega-3 to 6 ratio. When I test patients at the practice for a 3 to 6, everybody is high in omega-6, typically low in omega-3, especially if they're dealing with mental health issues. And we learned at the Italian Conference of Functional Medicine how it was all about mental health. And it was how if you can increase that omega-3 to 6 ratio, you can fix a lot of the inflammatory cytokine response of illnesses, of the mental health, of the hormone balance. A lot of that can be modified with the omega-3. But the problem is getting it in. We learned from one Swiss lecturer that you have to consume about 15 fish pills to get the required dose of 2 grams of omega-3, the DHA. And
I can
talk about that a little bit.
If I have no, I have my coffee and milk in the morning, but then later I eat my meal of vegetable and Spanish mackerel. I will feel euphoria. It hits. I know it's working. And then, of course, for the vanity side, eating I'll eat like 300 grams of a fish a day and vegetables, and then I might eat some eggs later, that sort of thing. Then you have the 0 visceral fat.
Mom's pretty thin.
This means a lot to me. That I was swelling in my 50s. I was getting like whiter and whiter, and I kept buying looser dresses, and the things I had done before didn't work to, of course, that's jumping to another thing. I think it's a combination of the hormone replacement therapy and my high omega-3 fish with vegetable diet. I had 0 visceral fat, and I really like that. I like feeling flexible.
We've proven that through DEXA body composition scanning.
Yeah.
On Mom. She's very unique. You know, most women her age, they do start to get that expanded appearance. And
you can't. It doesn't seem like you can do anything about it.
And when you look at, and my other issue, if we have any radiologists in the chat here, I'd like to hear from them. My problem with radiologists is when I order an MRI scan of the abdomen, they'll describe it as normal. But I've had to learn how to read these things and go through it with patients because their abdomens are full of visceral fat. But the radiologist is looking for a tumor or a kidney abnormality. They will not comment on the visceral fat, which bugs me to no end because we know that visceral fat is now an independent risk factor for cancer, for cardiovascular disease, for kidney disease, for diabetes, for heightened inflammatory responses to COVID, to viruses. So the visceral fat is super key. And if you just go around, you see any patient, you just go to Walmart, you can see everybody's expanded with this visceral fat. And maybe they'll say, well, my belly's not soft. If your belly is hard and big, that is visceral fat pushing on all your organs. You can't breathe in. Some patients will, I can't take a full breath, or when I lay down, I feel like something's pushing against my lungs. That's your visceral fat pushing up against your diaphragm. It's a huge problem.
Yeah, I felt more stiff in my 50s. I don't even have to do any yoga. I feel really flexible now. And it's not, and some people say to me, well, you're lucky. I have 3 siblings. They're all alive.
You're winning.
Let's just say they have visceral fat.
Yeah, you're winning for sure.
Let's see.
Did Dr. Quinn have a question? Because this is an open floor.
I know we're jumping
Okay.
around.
I didn't know if we were open.
Yeah, no, it's open floor.
Okay. My quick question for Mom is then do you start each day with your first meal with high protein?
I do start my day with whole raw dairy. That's been extremely important to me that I only take in raw dairy.
You mentioned mackerel, and I was wondering if that was like a routine. Hit yourself with protein first meal, because I mean, I've always been of that ilk.
I don't put any sugar in the, and it's only a half a cup of raw dairy because I have my coffee. And this is important. I keep glass in a glass measuring cup in the fridge, and I pour the espresso into it to cool it off so that when I pour it on my milk, I'm not heating my milk. Don't heat the milk over 108 degrees. And everyone's doing that. They're scalding their wonderful raw dairy, and it's not raw anymore. I can't get that into people's
Another
heads
big
enough.
thing is so I was raised back in Italy. Can you imagine this? No dairy. So dairy was banned growing up, even though we lived in it. So there's no formaggio, no mozzarella, no cheese on pizza, because mom had recognized early on is that if she fed the children pasteurized dairy, the children would get an earache. They would be congested. They would have mucus, and it took you a while to figure that one out.
I don't think you all ever had earaches, but you immediately got a clogged nose. Got a clogged nose.
Right. I think I had an earache once. You told me you put the old Chinese medicine warm salt in a wash rag and put it over my ear.
I had my Whole Foods canvas bag, and you warm up the sea salt in a steel pan, and you put it in the bag because the infection is yin, and the salt and the heat are yang.
And it draws out the yin energy.
Yeah, sure.
It worked. I never got an antibiotic.
Of course. Yeah, that works good.
Perfect. I was raised the same way, no dairy as a kid.
Oh, that's great.
Wow.
I mean, but I found the raw dairy is fabulous. I can have it. So anyway, I do start with the raw dairy and the coffee, but then the first meal is, definitely protein and vegetables.
Beautiful. Glad to hear it.
Yeah, on the days that I don't do that, somebody brings me a pastry and I have that instead. That day does not go well.
No, don't eat it.
Right, do not. Yeah. It was I'm still getting back into the rhythm after Italy.
So let's talk about another thing that's very common. I had two patients describe this problem today. It's how they can't turn off their brain, how they're thinking about mean things that they were said to them in high school, or something that they said 30 years ago. They can't turn off these intrusive thoughts. Now, what is that? Because you had that and you fixed that.
I can make that happen. I can make that happen to my brain really fast. When the brain throws up at you a memory from high school where you said something really stupid and you hurt somebody's feelings and you wince, that is your brain saying danger. It's like, danger for what? I'm not in any danger. That is carbs, the detritus of carbs hanging out, making your body inflamed. And so you start, and it usually happens later in the day after you've had a lot of carbs, not right when you get up.
It's funny. I've heard about that, and the theory I heard is that the processed food, and especially the carbs, stimulate the amygdala, right, which is going to cause that, and then it lowers the impulses to the prefrontal cortex, which is the adult in the room, which is the logical part of you, and so now you're more aggressive and whatnot, upset, if you will, just due to the foods, like you said.
Yeah. Well, I remember my mom, she would get up in the morning just so happy. And she was a realtor, so she'd be out getting a diet. She got not a diet, but a regular Dr. Pepper. And she would have more sugar. So by the time she got home at 6 p.m., she'd be so angry, throwing things and yelling at my dad. And I didn't know at that time that, she had a sugar problem. But who doesn't? I mean, if we went to the zoo and fed a bear a Dr. Pepper, it would make international headlines. We'd be in so much trouble. They know even though a bear's an omnivore, it can't have Dr. Pepper. But we all put it in there. So then if we watch our brains, we can then see how it reacts to that. If I can, that's what I'm excited to get the doctors in there. If I can get them to eat Spanish mackerel and vegetables, and then they can see how their guts clear out from the vegetables and lack of bread and cheese and things to clog it up, and that omega-3 hitting the brain, then they would be able to say, what's the difference then if I then throw in a croissant on top of that? You can see the difference. When people are sad all the time, they figure it can't possibly be the food. And there's often, as like with my mom, it took hours and hours to finally have a reaction. So you wouldn't really connect it to what you ate. You keep putting in the carb all day long. You might be burning quite a bit of it off with exercise also. I could just go on and on about that.
Good.
Eating is still extremely important. Extremely important. The pulling down of the mood when one eats at a restaurant with these hard cooked seed oils and all
Oh, that's a whole different thing. So my follow-up question then to you guys is, and I'm sorry to ask all these questions, but
Go ahead.
Stefan, do you go by the estimate of trying to get 1 gram of protein per ideal poundage of body weight, right? And do
Actually,
a
he told
heavy
me.
protein.
Now he told me that I would need, I would like to gain muscle, at least, at the very least, not lose muscle on any given day. And he told me I would need 300 grams of a mackerel a day, or 300 grams of protein. You get a
Wow.
tiny bit of protein from milk, the whole raw milk, and you get a tiny bit of protein from eggs, but just really nothing. And I find it difficult to get in 300 grams
Yeah,
of mackerel.
300
So
is a lot.
well, I split it up. I have a scale that has a sign on it in our kitchen. Do not remove the scale from the kitchen because when I finally get hungry, I don't want to be tempted to go eat carb. It's so much easier. I know I need to get my 300 grams of mackerel in before I could go have carb then. So that works better. I get the scale out. I measure 150. I put a little summer squash in the pan. Make the cook the Spanish mackerel super lightly because you don't want to hurt the omega-3s. Little vegetables in there, and then later when I get hungry again, the other 150. So if I can get that in, then I'll have some egg, maybe some carb. Although the squash also has a bit of carb in it.
Yeah.
One can get the amount of carb one needs a day.
Sure. Yeah, you probably don't
Yeah.
need much.
Yeah.
It is hard, as you said, to get all of that protein in, especially since that's the highest in satiety of anything, protein first, and right. So you don't want to eat as much. You can eat carbs all day, which obviously is bad for you, but the protein, it is difficult. If you just, I think sounds like with your diet, you're doing the protein and the fats and all that kind of stuff. And the carb stuff will take care of itself. You don't even have to worry about that, especially if you're working out. Stefan's got you working out. You'll blow all that stuff right off.
Um,
That is
I
true.
I do not work out as much as Stefan. He gets out
No.
there and plays tennis for hours. I
Yeah.
will. Yeah, I can feel it if I work out. I definitely put in my 6 minutes a day hanging. It's so important to me because otherwise
Well, that's great.
I wouldn't be working the upper body at all. And I adore my human growth hormone. Stefan has me on. I take a very small amount, but if I've worked out and I take that, then the next day, God, the muscles feel fabulous.
Yeah, that's
I would,
wonderful.
yeah, I would just have been, before that, I
Uh,
just would have been sore.
you're going to want to keep those muscles so you can always, when need be, bend them over your knee, and let them have it.
When they were in judo, I used to be able to
She used to be able to
challenge
judo.
them and I beat them.
You're like,
you
"Nice."
get on the bed like this and they're
Perfect.
supposed to be able to flip you over.
Yeah.
It couldn't move
Didn't
me at
happen.
all.
That's why there's weight classes.
Weight,
Now,
yeah. I mean, beat them in weight, yeah.
you said Spanish mackerel. What about sardines? Portuguese sardines
I would
or
love.
Sicilian sardines from Italy?
When we were in Bologna, at one point, we saw a store that had sardines and they had fried them. So next time we're in Bologna, I've got to try to get them fresh.
What about
And
canned sardines?
well, you can't do the canned sardines. The omega-3 is not going to it's not going to hold up to the whole heating and canning process. And also they put TSP on it. Do not go eat carb instead of TSP. I mean, it's a trisodium phosphate
Is it a stimulant?
it's a dangerous very, very alkaline chemical to break down oils.
But it says so on the can. It says there's this many omega-3s on the can.
Yeah, I know. Well, I've tried them. It's very flat feeling on the brain. And if it tastes salty, always if you get the sardines, here's the key, or the herring in a can, buy it unsalted and take a bite. If it tastes at all briny, they put TSP in it. And I've complained to the FDA. I've made a case with the FDA. They haven't responded yet. It's been a year.
And you said you didn't eat dairy in Italy, but isn't that all raw?
Is it Parmesan? is. Yes.
Yeah.
Yes.
All cheese is heated.
No, the
And
Parmesan is not
Southern
when
Italy is all raw.
until it's cooked. If you cook it like on a pizza, yeah, but usually it's
Yeah.
like grated on top of the pasta. But Parmesan is not.
No, during the
It is
fermentation process, they heat it up. They heat up
very
the
lightly,
cheese.
actually. So not much more than Dad does it when he makes yogurt.
If true, then that would be fabulous.
Yeah.
It's just difficult when they're heating. You'd have to constantly stir this huge pot to make sure that the stuff at the bottom isn't getting denatured.
Right.
Yeah.
tough.
Well, the mozzarella, if you heat it too much, it hardens. So
That's
you
right.
have to go very light on the heat while you're stirring it constantly.
I went to the
Wonderful.
cheese making factory in Emilia Romagna, and it is unpasteurized. That the stuff that falls to the bottom, they actually feed that to the pigs. So the pigs get that, and so that's why the pigs taste so good. They get nice like whey at the bottom of that barrel, but it's not pasteurized. Good stuff.
Uh-huh.
I want to show you guys the program that we have envisioned for healing sick doctors.
And then I want to talk about the FDA and HRT.
Oh yes, FDA and HRT. So I think you guys can see my screen here. This is the gym, the Human Performance Arena that Mom comes to and trains at every day. So Mom, you can talk a little bit about the cold plunge therapy that you do here.
The overarching really important thing about the HPA is that like it got me completely off alcohol. It is a place we go in the evening and it's so lovely and it's better than any gym I've been to. The setup, of course, it has the ice plunge. And a sauna that I like. Usually saunas, you can't breathe in them in people's gyms, and I've never understood why, and now I understand why. So instead of, after 6 months of coming to the HPA, after Stefan's wedding, I said, I'm not going to drink alcohol ever again. And occasionally I do, but went from whiskey every night to zero because we had something to do in the evening that gives endorphins. It gives an incredible sense of relaxation. So to me, the alcohol was also to counteract that the day of carb, how the brain starts to feel sad and tight, kind of balled up from all the carb. So at the same time, I was cutting way back on carb because I had to get my 300 grams of Spanish mackerel in. We were also coming here in the evening. Cured, if I was an alcoholic, cured it without missing it at all.
I really would like patients to experience that because I hear this all the time and I know they're not doing these things that I know can help them. And so we have to reach then into our other cabinet. We have to reach towards ketamine therapy, which I'm not against, but I would like it if patients could do the bare basics of mental health and brain optimization, which is the diet.
Yeah.
First, would you say diet is more important or would you say exercise is more important?
Diet.
Diet's more important.
Just stay out of if you could just get up and eat the protein, high quality protein, if all you've got is grass-fed beef, okay, well, don't overcook it because there's just a little bit of omega-3 in there and that overcooking it will harm it. But all in all, if you stay out of the restaurants and eat well, that's number one. Because it's hard to go work out when you're feeling sad and your brain is balled
That's
up.
what patients tell me.
Yeah. And
Stefan, remember, you can't out exercise a bad diet.
Yes, exactly.
Yeah, they won't even start to exercise because they're so depressed. Their brain is so balled up.
Your guts hurt.
They don't even want to.
They can't sleep because they're thinking constantly about things they did 30 years ago or things about the next day. They can't turn off their brain.
Oh yeah, it's diet. Start with the diet. So we started Stefan opened the HPA. So Thomas and I started coming there. I do the full body red light therapy, 8 minutes on each side.
I'll show you where that is here.
You don't want to overstimulate the mitochondria, but you want to stimulate them. And before I take it, I'm going to start trying some methylene blue because that sounds like a really fun experiment. But before I go into the red light therapy, I definitely take some hyaluronic acid, some C, some A, and a really good collagen. I personally don't think that the beef collagen, the dried stuff, has much oomph. And I also don't like fish collagen made from scales. I don't know. It doesn't seem to work. The fish collagen made from fish skin seems to be the most helpful. I mean, I do eat fish skin on the Spanish mackerel, but I take a lot of it. So 8 minutes each side on the red light therapy. Then Stefan recently got a massage chair I just love. He didn't have that at the beginning, but it's a lot of fun.
There it is. Yeah, this thing.
I saw at the local health food store, they charge $1 a minute in there.
Oh, wow.
Yeah, as your uncle. So yeah, it's worth $1 a minute, that's for sure. And then I go out to the ice plunge. And if there was only one thing I could do, it would be the ice plunge. When this is so anti-inflammatory, it's amazing. If one has been a bad girl and eaten too much carb and the brain is feeling balled up and you're feeling a little sad, you go into the ice plunge for 3 minutes and it's just gone.
I mean, it is gone because well, you get a lot of hormones. When you go to ice water, we keep it very tightly regulated. It's between 35 and about 38 degrees Fahrenheit. And when you submerge yourself for 3 minutes under that temperature, you get dopamine release, you get norepinephrine, noradrenaline, you get more cortisol. And cortisol is a good thing. It helps with inflammation, it helps people have energy again. And it is such a good form of dopamine because it's a hard thing that you need to overcome and do. It helps train the sympathetic nervous system. You can learn to control your own vagus nerve for breathing correctly and actually submerging, getting up to the carotid and stimulating that vagus nerve to calm down and retrain that fight or flight response, which it seems like a lot of patients have a problem controlling their autonomic and sympathetic nervous system.
I like the dopamine a lot. I keep my house at 82 degrees. Wow. I like it warm. I have a blanket on me here.
It's hot in here.
Because I find it cold in here. So I'm not somebody who has ever, we used to have to go to the University of Tulsa every night and jump on the cold water for swimming practice. And I hated it. But it probably, and I remember actually every night when we jumped in, all of this phlegm came up. And I thought that the gutters were for spitting because all this phlegm came up. So probably the cold in the University of Tulsa helped move all of that pasteurized milk out of my lungs.
I don't know what it was about that. But yeah, you're right. You were pretty congested back then. You were a singer, right? And you couldn't sing because of all the congestion.
I got congested.
Now you don't get congestion anymore.
No.
So are you doing the ice plunge at night?
Mm-hmm. Yeah.
Yeah.
Wow.
I do the ice plunge. And then when I come out, I mean, nobody bothers me when I'm in there because I have my headphones on, I'm singing. I stay in for 3 whole minutes submerged up to here with the arms in. And then I come out just enjoying the dopamine. People know not to talk to me because I don't want them messing with my high.
Yes, it is a high.
I'm not embarrassed about it. I used to do that with wine, and now I do it with ice.
And it took you a while to get there. You didn't do that the first time.
No, you know what really helped me? The toe covers.
The toe covers. Okay.
Stefan made fun of me. The toes, they just don't
have
have
neoprene booty on the tip of the toes.
Right,
It does help.
There you go.
Made of polyester.
It really helps.
Any cloth on you will keep you warmer in there. The toe covers.
And you don't have trouble sleeping after that?
I would if I didn't go in the sauna. So
okay.
after the ice plunge, I immediately do body weight. Like I'll hang.
You hang from the Rogue apparatus here.
I'll hang from the metal, and I've started doing ring work recently. Balancing on the rings and doing leg lifts and squats. And then I'll move up to adding weights to the squats, and then I'll do some other weights. And in that way, when I'm all warmed up and done some calf lifts, things like that, or I'll come in the carriage house and get on the vibration plate and do some bands.
Yep.
Then I go in the sauna. And that is another dopamine where you're enjoying the last bit of freezing coming out of the bones. It feels so good. It's so enjoyable.
The sauna also has a lot of endocrine effects and it helps people feel good. It increases growth hormone, vasopressin hormone, antidiuretic hormone. There's a lot of these hormones that you may not be getting, but you will get them by going in the sauna. And of course, we're under the sunlight as well, which is huge. And you're getting sunlight exposure on the body while working out. Here's my dad, a picture of my dad.
I do like coming to the
Lifting
HPA
that
when it's
row.
sunny. We usually come in the evening because that's when Thomas is off work. But on the weekends, if we could come when it's hot, it's easier to get an ice plunge when the sun's on you, it's hot.
This is some of the program we have envisioned for if you have a really, sick doctor, a sick patient, come here for a boot camp, like our ideal program to see if we could really fix somebody with this protocol. It's pretty strict. I mean, it's kind of like, I would call it like maybe a bit of a boot camp, right? Because
And I especially want the depressed. I feel like that would be, if they would do the boot camp, I figure we can have some positive results.
right. So it would be you want them to have their wake up coffee time, and then the breakfast is the first meal of the day is super high omega-3 vegetables, miso soup, which I can show you what that looks like. I have a picture of a miso soup here with squash, Spanish mackerel, and dandelion leaves.
That's my breakfast.
It's very tasty, actually.
Yeah, I eat it again later too.
Yeah, you can eat this a couple times a day to get plenty of omega-3 in. And then they would come to, what was it? They would come to Iron DPC and they would do the training with me here, do the full protocol, ice plunge, workout, sauna, red light, massage, the whole thing.
They might do the hyperbaric chamber first. I think it's better earlier in the day.
Right.
Thanks.
So the HBOT is another thing that mom does. So you want to talk a little bit about your HBOT experiences?
Yeah. Starting in the 50s, I had cracked heels, the old lady cracked heels, and people go, "Well, you scrape it to make it go away." Yeah, you scrape it, but it must be a fungus or something in there. It never seems to really heal up.
And no one knows why it happens.
And people aren't sure why it happened. They go, it's cause of aging.
That old one.
If I do the third day of doing hyperbaric chamber treatment for an hour, it starts healing up. And within a couple more, it's all smooth again. So, I mean, everybody knows that that's what hyperbaric chambers are for. They're for healing. And I've proven that over and over. The reason I don't go in will just be laziness or I'm busy. But when I do go back in, then the heels all heal up again. I'm hoping that it improves collagen production.
And cognition, right? It's great for inflamed brains.
The thickness on the heel, I was taught by Warren Levin, that has to do with hypothyroid. And so you'll get hypothyroid.
Yeah.
That has to do with hypothyroid, and you'll get thick calloused heels and calluses on your feet. And then when you balance your thyroid, they just kind of dissipate.
I agree. I've been trying to get her to increase that. She likes to go very slow with the hormones she takes.
Yeah, we could talk about my
Yes.
slicked.
And bike back. And then last meal, you like them to finish, around 5, 7 p.m. last meal?
That would be lovely to go to bed completely empty stomach. That would be great.
May help with sleep, right?
Yeah.
Not eating with a stuffed abdomen.
Yeah, I think I've heard quite a bit about that. People saying, scientists or doctors saying that with all the blood going to digest all the food people like to eat after they go to sleep, you won't be sleeping as deeply, and you're trying to achieve. I mean, when people call me saying they want to join Stefan's practice, I say keep track of your symptoms on a scale of 1 to 5. Sleep. And when you try different things, how to go, keep track of your sleep. How many hours did you sleep? Right. Logan has a cool device that tells her how much REM sleep she had. That's cool to have. So if it doesn't work for you, if eating a big meal helped you sleep longer and better, that's science. Do it that way. I think though stopping earlier is better. But people, after they're done with the boot camp, can tweak things their own way because everybody is different.
Another one of the big things I like to teach patients about brain health is actually resistance training. Patients say, well, yeah, I exercise. What do? They walk the dog or something. No, that's not good enough. You actually need to build muscle. You need to do progressive resistance training. You need to put your body under a load. You need to do it
You know
a couple
what?
several times a week.
What Stefan is saying here, and I said, and I just said, is something that is a lot of work for you doctors, but too bad. It's work that's worth it. First, everybody's different. The patient might come to you and say, I'm just eating all this protein and I cannot sleep. Well, then, maybe they need rice before they go to bed or potatoes. Maybe potatoes do not work for them. Maybe it needs to be squash, and they're going to come back. You're going to try different things. They need to keep track of what they've tried. It's like, because people won't remember that for some reason the nightshade, the potato, kept them awake. Other people, the potato doesn't bother them at all. So yeah, they might have to do iterations. They may have to try different things. And then the second thing is, of course, encouraging them to do the good things. You're a cheerleader, and you're looking at their progress and their blood draws and having them reflect on what they've done as you're trying to reach a longevity goal. It's a lot of work.
They need to put their body under load. They need to do difficult things and challenge themselves. And I don't feel like enough patients are doing it. I feel like the patients don't understand, and doctors too. Doctors don't understand really what it takes, how individualized it is, how much effort it takes to be optimized. It's much more easier to reach for the drug, right? Even in functional medicine, we are not excused from this. Like, we'll reach for ketamine therapy or a CBD therapy, or we'll reach for the low dose naltrexone, right? Instead of reaching for the SSRI. But the real healing, especially for the brain, it happens with all these things that we've been discussing today: the lifestyle measurements, the sunlight, the cold exposure, sauna, red light, putting the body under a load, doing the hard things. That's where you're really going to get brain optimization and healing.
And all those things. I mean, it could be that for some people, the red light therapy first thing in the morning is better for them. Since I come here and this is my restaurant, this is what I do in the evening. I tend to do all the things in the evening, and
But that's something that you should explain as well. But you just threw that out there. But a lot of people use restaurants, going out to eat, going out to drink, as their social thing, as their way to wind down, to turn off the brain after a stressful day at work. They are doing things that are negative for their brain health rather than positive in an attempt to de-stress and unwind.
yeah, it should be. I mean, it is so pleasurable for people, so much pleasure to have somebody serve you the overcooked meat that's incredibly salty, made at the restaurant, and the alcohol is relaxing the first glass, but then then the alcohol means that they don't
People
sleep as
don't
well.
know that. They think it's perfectly fine.
Well, you don't sleep as deeply after having the alcohol.
I mean, if you're struggling with a mental illness, you're struggling with recurrent herpes virus, mold, mycotoxins, you name it, you need to really focus on the bare basics of health. And you may have to eliminate some of these things that, it's okay, I can go out for a couple drinks. Well, you need to start with a baseline, and then maybe later you can add on these things. But what I found is patients are so full of toxins, they're so full of poor lifestyle choices, that they don't even know what it feels like to be good. They don't know what that feels like.
Yeah, then they wouldn't be able to gauge.
They don't have a
if
gauge.
They should tweak something a little bit because they don't know where to start with that. I mean, I see so many women my age. I call it group carb eating. They go out and they all show that they're group eating a cake. And it's like, we're all wealthy. We can have cake all day.
Yeah, we're in America. You can get cake anytime.
It's not the 1700s.
You need to take a picture of it and post it on Facebook.
It's difficult to find sugar, or you had to kill a beehive to get some bees. We actually have to fight to get in all that protein, especially if women don't have that much appetite when they're older. I think guys could probably get in quite a bit of omega-3. I cannot eat that much.
Right. Do we have any questions from our attendees here before we wrap it up?
We're not going to talk about HRT, my favorite.
Well, we could. We got our expertise here, our William Clearfield HRT expert. You can hear it from
one episode of red light therapy with ketamine, Trochet, and it feels like a nootropic. And
I'm sure.
neuroinflammation and neuropathic pain. That's from Tony Arnott.
Tony Arnott did that one. Great. Good to hear. I'm
So
glad
Dr. Clearfield, you're big on hormone replacement therapy, yes?
he's the guru.
I've had a little experience with it, yes.
A little bit. So tell me, do women like nandrolone?
Some do, yeah. I don't have a whole lot of experience with it, but some do, yes.
It's my favorite.
It's her favorite.
Why don't you tell us about it, Mom?
Stefan put me on, I didn't want to do any hormone replacement therapy because I haven't had a vaccine since 1967. I haven't had an antibiotic since, I don't know, high school, maybe college. I gave birth naturally, but I thought, well, I'll try a small amount. And Stefan gave me a small amount. It turns out I'm very sensitive to it. If I will actually take testosterone and I will turn it into estradiol, and then my period wants to start and it spots. And so I had to cut way back on that. And I forget at what point. So I was liking then finally the lower level of testosterone, and the estradiol seemed fine. But then the nandrolone, here, cover up your ears, Stefan. The day after my nandrolone shot, my husband is bound to get lucky. It is. It makes me.
Mom.
It makes me confident. I feel, I'm driving down the car, enjoying the music like a teenager, and the libido. I have to take a very, very small amount. It makes the libido very.
Nandrolone.
1 unit, right?
I take 1 unit, yeah, and then it feels better a couple hours later that day, and then the next day.
And how often?
I take it 1 unit once a week, and then every third day I'll take 4 units of testosterone, but it's a diluted form of testosterone.
Oh yeah, I think it's only 20 milligrams per ml. It's a cypionate that's like super diluted down.
I take super diluted testosterone, and then 3 days later the nandrolone, and I keep doing that. And when I ask my husband to give me a shot, he goes, "Yes." he does not mind. I see benefits.
I think the first introduction, the red pill I got you in was progesterone, right? Because you were against all hormones until I started you on progesterone.
Yeah, I was having trouble sleeping. That was way back when I was still drinking wine.
Whiskey, right?
Or whiskey.
It was peanut butter whiskey.
And now I realize that was waking me up at 2 a.m., but I needed it to relax my brain. So it was it's a combination of things. It was the cutting back on the carbs so that my brain wasn't so balled up. I have that whole story to tell where when my brain was balled up, we used to go to an acupuncturist in Orlando. He could throw chi. He could still throw chi. I used to call his son Magneto. And he was able to drain the balled up energy out of the head. And I feel like a billionaire after that. But it turns out I would just go eat more carb after that. And it would get balled back up. Acupuncturists are very cool that they can move chi around. But the question is why is the chi stagnated? Why is the chi balling up somewhere? That's the question.
A lack of omega-3, apparently.
And too many carbs, yeah.
There you go.
And not enough ice plunge. And
question is why nandrolone versus testosterone?
Exactly.
I don't know.
Well, she does both.
The testosterone is also makes one feel way too sexy. I had to way back off on that. But the nandrolone gives that little confidence that the testosterone doesn't.
Well, I put her on it to improve her bone density. That's why I did it. And then we just found out it worked for other purposes as well.
So what is the nandrolone pathway?
Well, the nandrolone is an interesting product because it's 10 times more anabolic than testosterone.
Exactly.
And I mean, you have to do very low doses on it because it can convert to DHT. But it works very well for bone density. That's where it's studied on in osteopenia and osteoporosis. And it can help with pain is why we found it. You forgot to mention that it helps with your...
Forgot about that. I used to have so many symptoms. Who remembers? For a long time. Oh, I remember back on the Gerson diet, around 3 o'clock in the afternoon, my middle back would just start hurting and hurting. And one Googles that, that was 20 years ago. You Google it and it says, well, it means you have pancreatic cancer. I was like, well, I don't have pancreatic cancer. And I would do stretching and laying down, it just disappeared. And then by lowering carb, it was a lot less. But if I did a lot of standing, I still had it. So I'm not sure exactly where the pain comes from. But Stefan gave me nandrolone, and I was like, I have a product I have to package myself in 2-packs and 4-packs, and I had to do that for hours. Can't get my daughter to help. And I noticed I was able to do it with no back pain from nandrolone.
I figured it was coming from your back. So I mean, a little bit of arthritis maybe in the backs. The nandrolone is great for any sort of inflammatory joint condition and any sort of bone type pain. It's a phenomenal product. Low dose, of course, doesn't take much.
Yeah, I do. The back doesn't really, I don't really notice it that much at all now. It's cool.
What's the half-life of the nandrolone versus testosterone?
It's the same. It's a cypionate, so it's like 7 to 14 days.
Oh, I thought it was.
Okay.
And it took me, and once again,
She'll tell you it wears off in 6 days.
as Dr. Clearfield knows, the hormones are an iterative process. It took me quite a while to find the level I like right now, and I might need to tweak it. Progesterone was very difficult to find which amount. I have all these different bottles at home of 100, 80, 60. Because if you take too much progesterone, you wake up with your arm asleep because you didn't move. It put me to asleep. And if you take too little, then you're not sleeping as well. So,
Are you using an injectable progesterone, you said?
Oral.
right for bed.
But
Little tiny bit of melatonin.
okay, there's a question about Lovesa, which is, I guess, the prescription omega-3 or fish oil.
Oh, like Vasiput?
Yeah.
I mean, I'll give that to people who don't like fish or have the indication hypertriglyceridemia, cardiovascular disease. That's when I'll prescribe it. Otherwise, I just have them drink fish oil or eat fish, ideally.
Okay.
Most fish doesn't have that much omega-3. It is a tricky one to get.
Well, everyone's deficient in omega-3 if you run their levels. Yeah.
So nice to be high on the omega-3. Like the ice plunge, there's no downside to this high. None. You can have it daily.
Okay. What about so there's a question about contraindications or side effects to monitor for with the usual testosterone side effects? Is that
Usual testosterone side effects.
Well, if you take too much and it turns to estradiol, then your period wants to start and you notice your uterus. That's just annoying. But just cut back on it till you find I mean, I'm not a doctor, but for me,
true. That's isn't that right, Clearfield? You hear about that all the time, right?
Yeah.
What?
Yeah.
There's a question about, is it DECA or NPP in
Nandrolone. Nandrolone is what you'll find at compounding pharmacies.
Okay. And what was that question again that you asked me? I've had my mind on looking at the questions here. So
someone said farm fish have no omega-3. That is true.
That is true.
And Mom did a lot of research on that.
Oh, yes. Oh, I remember once I was at Publix and he was telling me, oh, the farmed fish is just like the fishmongers. Fishmongers are trouble. The farmed fish is just like the fresh fish. They're fed what they would eat out in the ocean. So I went home and I called Scotland. I got the number from him, called Scotland. The guy says, hey, we feed them rapeseed oil. He admitted to me that they're only in nets in the ocean, the farmed fish, because then they don't have to clean the poop. The
ocean currents
the
take care of that.
current takes the poop away. Otherwise, they feed them big old balls of rapeseed oil.
Rapeseed oil.
And there's no omega-3 in those poor fish.
No.
It is a kind of a yummy, squishy, oily taste, but
Oh, you could taste it. It tastes like oily and fattier.
I've seen people in summer. Have you seen the retirees pointing and choosing the farmed salmon when there's wild salmon right there?
Boomers.
Now, In summer, there's wild caught salmon, and I used to think that that was as good as Spanish mackerel, but now with my experience, I don't know why. Publix swears that the wild caught mackerel has not been frozen, but maybe it's just really old by the time it makes it to Florida. It doesn't have the oomph of the omega-3, and it should by analysis that a fresh Spanish mackerel does. But it's not bad. It's like 80%. It's just I want the whole thing.
As mentioned before. Oh, I'm sorry.
No, go ahead.
No, as mentioned before, the omega-3 comes from the algae that the fish eat, and farm fish don't eat the algae, so they don't get any omegas.
Oh yeah, I mean rapeseed oil. What's in that definitely doesn't have any omega-3, and I know for me
It's also known as what is it, canola oil?
oh,
right?
also
Canada.
also sushi. That seems like such a healthy choice when eating out. By law, it has to be frozen. So even though you order salmon sushi and you pay an incredible high amount for it, yeah, it doesn't have that much omega-3.
No.
Yeah. So Dr. Smith writes, addressing some of the resistance seems to help a lot. Listing the advantages of detrimental health behavior out together and with the patient, and then listing out the disadvantages of giving that behavior up seems to help them really want to change.
Yeah, that's exciting to be I mean, people have to go to church every week to stay on the straight and narrow. It's not possible for the doctor just to tell them once to do something healthy. You've got to, it's there's too many temptations out there. You got to pump them up and have them understand the process they're on.
We as clinicians need to lead by example. You have to be building your physique. You have to be training. You have to be eating the right way, showing your patients this is how it's done.
We all admire Dr. Halassa and his efforts at your clinic there. So
yes, we're gonna get everybody in the cold plunge at some point.
So how long have I known you, Stefan? 5 years, 6 years? 7 years, a long time. Why have you been hiding, Mom?
I tell people when they
who to call now if we have a last second dropout, I know who to call now.
You go Iron Direct Primary Care, Google it. Her phone number. You're gonna get her if you Google Iron Direct Primary Care.
I'm gonna put Mom on.
Oh, that's great. When people call asking about the practice, I say, "Oh, let's talk about health," because people can schedule online. I don't. Sometimes people make me schedule for them, but usually if they're calling,
yeah, it's fully automated, but they still call and we'll get Mom.
Yeah. We'll sit there. We'll talk for 20 minutes about what they've got going on and what I've got going on. I'd like to talk about what the immortalists on Twitter are talking about.
Oh yeah, you can find her on X. Give your X handle.
Izzer's Tennis.
Izzer's Tennis.
That's my patented tennis scoring device. But all I talk about on Twitter is longevity.
Longevity. So her and it's like 10 or 20 other researchers and scientists talking about, resveratrol, NAD.
Which is really funny. Y'all ever heard of True Niagen?
Yeah, of course.
You've heard. Yeah.
NAD precursor.
So if you'd like to chat with Dr. Brenner, who invented it, I've chatted with him. If you're not Taylor Swift, you don't have that many people following you on Twitter, and you can talk to experts like that. He loves to make fun of bad longevity research, and I appreciate that. I tell Dr. Brenner, people say, "Oh, you're being mean," but I'm like, no, we need longevity research now, not wasted on the nonsense that sirtuins are longevity genes, that kind of thing. Very fun stuff.
Hey, Dr. William, by the way, Stefan, you got a very nice platform here to invite Dr. William to join us in end of December of the Christmas, so we can put him in plunge him in the ice and then put them in the hellfire.
Yeah.
Yeah. You want to go, Dr. William? You can see the
I think I'm
heaven and hell there.
I'm going to be in Miami 3 times next year. But at the end of June, my kids are the end of January though. My kids are visiting their grandparents in Miami Beach, so I'll be there, and then I'll be with Dr. Farshian in March, I think, and then in April is AMMG. So I'm going to be in Miami a lot. So I know that's not Melbourne, but maybe we can make a detour.
We can make it happen.
Yeah, if you don't hit the traffic, it's a nice drive on the 95.
I drove last April in Miami. I thought I was going to die. It was
Oh,
the
yeah.
Yeah, yeah, you need
part.
to, you need
They
to
come to
somehow
Reno and they
avoid the traffic.
complain about 5 minutes having to wait 5 minutes at the one spot where you get stuck here, and it's like, oh, you're ridiculous. So, um, Dr. Berger writes, I'm not sure exactly what the question. Anybody prescribe just omega-3s without omega-6? I'm not sure what the question is there or what.
I don't want omega-6.
No, no one actually
Nobody wants omega-6.
omega-6.
Do you measure anything while using nandrolone? Testosterone, estradiol, anything?
He likes me to give blood for the analysis. I don't
Yes, you
I
need to do
don't
more
like.
blood work. She doesn't do it enough.
Data is really good. I try to avoid blood draws, but
You gotta do it for the sake of science here. We need data.
Yeah. What about saliva testing? Dr. Smith's been making her circuits here, and it's saliva testing is it. So, according to her.
She did that one time, Mom. She did the saliva testing after she broke open a capsule of progesterone. She put it in a shot glass and she took it. And then she did the spit test. She had a progesterone value of like 2,000 plus. It was like greater than 2,000 plus.
things one needs to know.
What is the name of the clinic? I guess your clinic, Stefan, is Direct
there.
Primary Care.
So
Iron
gotta-
Direct Primary Care. Yeah.
It's a real sign, not a fake background.
No, no, I know. No, no, we don't allow you to do anything fake here. It has to be all real. So
So from no, because the FDA just recently said, oh, by the way, hormone replacement therapy, it's good. So I went from no hormone replacement therapy to I take a tiny, tiny amount of get up and I take NP thyroid and DHEA, and then
Pregnenolone?
I'll take the pregnenolone and the progesterone and a tiny amount of melatonin
At night, right?
at night, and then as we mentioned, twice a week either the testosterone or the
And
nandrolone.
the estradiol, when do you do that?
Oh yeah, estradiol. I will whenever I wash my face, I'll put it on, and then
You put it on your
before bed.
face?
I've found recently I'm moving it around to other parts too.
Yeah.
That's something I'm kind of finding out, not just on the face. And yeah, if I put on too much estradiol, yeah, once again, the uterus, I start to notice it. It feels funny. And that's a whole discussion. We probably won't have time for that. I guess we had I'm certain we had it a lot easier dealing with inflammation when we were younger. And then it gets, after there's, your body's not asking you to get pregnant every month, it becomes more difficult to get rid of inflammation. I guess that's why I was swelling so much in my 50s. So the level of all of the hormones I take, it all just works better, and I'm much more sensitive to it if I don't go on a bender, like when we went to Disney World with my sister and Epcot, eating there and drinking too much coffee. It kind of messes it up. So that's a whole nother thing, a whole nother reason all you doctors have to tell your patients that it's work, but it's worth it. You're older now. Don't be going to a party and group eating cake. You're on hormone replacement therapy. Help it along. Keep that inflammation down, because inflammaging we can get rid of right now. We don't need immortalists to wait for the AI to give us a magic longevity pill. There's so much to do right now, but it involves discipline, and maybe it always will, even if AI comes up with good ideas for creating super longevity.
Right. The AI won't give you discipline. That's what you have to do yourself.
Yeah, I don't think my gut feeling is that there's not going to be an Ozempic for aging, and if there is, it'll be like Ozempic. It might have some side effects. It's all going to work better just right now. Like they've finally figured out that hormone replacement therapy is good. It works a lot better if you're on some high quality protein and vegetables and a little carb than Epcot. Don't do it. Don't do
Well, they didn't really say it was good. They just said it wasn't as bad as we made it out to be.
Is that what they said?
Still hedging their bets, especially on systemic estrogens.
Well, I would think, I got a call the other day. A woman called and she said, "Well, I was on testosterone and it didn't work." That was her experience. She went to the doctor. He gave her the prescription. I mean, mine is so different than the general. And then she just thought it didn't work. I mean, how could it not work? But so
There's usually one of two reasons. Not enough dose, not a high enough dose. Didn't give it time to work, depending on the delivery system, or she didn't really use it and kept skipping.
yeah.
Those are the three reasons. Otherwise,
And there might be a third one that she was fasting on some days and it had one effect on her. And then other days she was out group carb eating with her friends because that's what women do to try to stay fit. They don't eat, don't eat, don't eat. And then they eat incredible inflammatory stuff, which in my experience messes up the hormones. They're fighting a certain amount of inflammation and then you're throwing it in there. And
Okay. There's a question about do you recommend DHEA if on testosterone, or do you need both?
I take DHA in the morning. I take
Yeah, we
25
take
milligrams.
DHEA alone for its benefits in preventing cold illnesses, in improving your immune system.
Oh, I want to talk about that. With aging, everybody is taught in med school, and if you ask AI right now, what happens to the immune system as you age, and they say important parts of your brain disappear, and you don't make T cells anymore, and then you die. Now, this is patently, of course, not true. We have all kinds of people age 80 who have immune systems. And then the other idea is, well, they only have an immune system because they vaccinate. My immune system has never been better. If any of you want to go chat with somebody who has RSV and COVID and also a norovirus, I'll go chat with them. My immune system has never been better, and I'm ancient. Huge thing was switching to raw dairy from cooked dairy and getting completely off alcohol, keeping the inflammation down, I guess that would, and not needing to detox denatured milk proteins. So we can still have, I think I took a test on the methylation of my immune system, and it was like 2 years ago, and I had a 40-year-old immune system, but oh, it's better than that. I used to get the flu. I used to get bad flu back when I was age 30, and I don't do that anymore. Right. Immune system. It can be, we can have it.
I'm gonna be a little bit of a naysayer here. DHEA actually works quite nicely as a counterbalance to cortisol. And we do a cortisol DHEA ratio at about 5 to 6 to 1. If it goes higher than that, then you have too much cortisol. But I was, and this is an observation. I don't really have any hard data on this. That when you have adequate testosterone levels after 6 months to a year of, and again, we start very low doses with testosterone and build them up over 3 to 6 months. We don't start out with the quote unquote therapeutic dose. It's been my observation that we get a negative feedback with DHEA. And that when we use DHEA, especially if you're drawing levels, either saliva or in serum, the levels drop, even if you're treating patients with DHEA. So it seems a bit of a conundrum there at how to explain that, because patients come in, I'm taking 25 milligrams of DHEA, and for females, my total testosterone is 35, and my free is about 2.5 to 3%, which is adequate. And it's been that way for a year, and the levels seem to drop. So there seems to be a negative feedback. So I've been shying away from using it when we have adequate testosterone levels. We'll start out with that, and then when we get to our therapeutic levels, I'll start backing off.
Oh, cool.
Again, that's my observation. I've been doing this for 25 years, and
right.
I'm wrong.
Yeah, I don't.
I've been wrong before.
Well, I don't notice anything from DHEA, so I'll leave it out and see.
It's a very mild product.
It was FDA approved in 1952 or whatever it was back then for major depression. So there is some, antidepressive properties to it. And again, it's the quality of it. I mean, if you're getting it from the dollar store, obviously, because in the US you can get it over the counter. If you're getting it in the dollar store, it's probably not, what it says on the label. If you get it from, the pharmaceutical grade companies, or you have it compounded, you can be reasonably assured that you're getting the real thing. So, but then again, that's my observation. Someone asks about estriol on the face rather than estradiol. Any experience with that?
I mean, if you talk to Gersh, she says estradiol is all you need.
Yeah, I know. That's who I talk to. By the
That's who
way,
I talk to.
she's going to be at the conference next week, and you
Oh,
should be
great.
here too, or at least online.
I'll be online. I'm already going to go to Las Vegas for A4M, so that's enough travel
No,
for
that's the
me.
next week. Will you come here? Marlene Siegel's coming to us, and then she's going to Las Vegas.
Oh, wow. That
She's
gets
from
around.
Florida too. And we would have, if I had known her, we would have given mom the keynote speaker here. He's great.
Oh, you're sweet.
That's great.
Um, uh, uh, so it asks, do you stop DHEA? Usually I do. I stop DHEA after probably usually about a year when they have adequate testosterone levels. Free testosterone 2 to 4% is what I shoot for free testosterone for women. So, and I figure it's kind of been discounted. I like doing free androgen index. I know that you'd rather do the bioavailable testosterone, but that one I need some online thing or what. I'd like to be able to do things in my head. So free androgen index, which is total testosterone divided by the product of sex hormone binding globulin times 0.288. That'll give you the right units. For males, 30 to 130 is considered normal. About 50 to 110 is our optimal. And for females, I think it's 0.8 to 5.9 or 6.0 is normal, and 2 to 4%, 2 to 4, 2.0 to 4.0. That's kind of our ideal. So,
all right, Professor, we're
Dr.
going to close
Eberling
it out.
says it's past his bedtime. Happy Thanksgiving. Well, thank you for being with us.
Everybody, and
So,
be good
Mom,
Thanksgiving.
you are great. You're invited back anytime. We tolerate your son, but you are really a gem and a joy to speak with. So I wish most of our speakers were as enthusiastic as Mom here.
I'm so enthusiastic about this. I mean,
she's the greatest secretary I could hope for. She loves anti-aging medicine.
When Stefan said, let's go to Bologna, I was like, I just want to do my longevity work here. Well, we did end up having a fabulous time.
We had a great time. Eat pasta every night. Oh my God.
Yeah, but I'm so looking forward to all my dopamine here that I have all worked out.
It is nice to be back in my routine. Italy was fun.
It's a nice
routine. Conference was great, but it's great to be lifting weights and cold plunging again.
Italy was better than the England conference.
Way better than the London one. Yeah.
Yeah, because coming up Saturday, that the England conference is now in Bangkok, and they got me speaking at 1:45 a.m. my time. So
how'd they rope you into that?
That's what their time is there.
I don't know. Yeah. No, I'm talking about the myths of testosterone therapy. So,
all right, good.
Anybody's interested, I'll be on at 1:45 a.m. LA time, which will be 4:45 in the East Coast.
Oh wow!
So it's 2 in the afternoon in Bangkok, though. So, okay. So, yes, happy Thanksgiving, everybody. Stefan, or Mom, heck with you. Mom, any final thoughts? Any summary? Any wrap up?
I did forget. I'm also on the HGH. So I take all now. I went from no hormones to I'm on all of them. I don't think there's one. I'll skip the DHEA and see what happens.
We got our own little Terry Hertog here, huh?
Yes, yeah. She loves Terry. Terry Hertog did the whole dog and pony show on her.
Yeah, he was complaining that I had swayed back, and that was fun. He was saying what was wrong with me. Longevity work is the coolest thing. I don't understand what anybody is spending any other money on. I mean, I had a great time in Bologna, but if I had a visceral fat problem or depression, of course, a lot of women feel that Italy will cure their depression. Cruises, vacations cure it for a little bit, but finding a way to create dopamine through
It's the long
sauna.
term. It's like, you know, it's
Ice.
sort of like your marriage is on the rocks. Let's go buy a new house.
Yeah.
Yes.
Yeah.
Yes.
Yeah.
And, you know,
Whereas if she was feeling high from fish and ice plunge, you can do that every day. You won't get sad after you buy the house. You don't feel sad after ice plunge.
you feel sad when you have to divide the house 6 months later. It's what it is. So,
The 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 buying the house a sadness afterwards after getting it. Now there's no sadness after fish, and there's no sadness after uh, nandrolone. There's no sadness after exercise. There's all of this is only good endorphins.
okay, terrific. All right, and
Have a
Stefan,
great conference next week,
yeah,
then.
yeah. Thanks, Stefan. Thank you so much. And Mom, we can't thank you enough. This was
Oh, you're so sweet.
you
Anytime.
are just a gem. Well, we always have last minute folks dropping out, so now I know who to call because I feel bad. Stefan always, if I call him, I said, hey, my speaker tomorrow night is gone. He's always there, so now I know who to call. I won't bother you anymore.
Oh,
Excellent.
I always got something for you.
Excellent. Yeah. Yes, sir.
How'd you like it, John Burgess?
Anybody else? Anybody else have any comments or questions?
I tell Stefan the sound is good with your equipment too. Thank you.
Oh, appreciate it. I thought you'd like it.
Yeah, this is nice. I'm kind of whispering. It's cool.
Yeah, I can hear your feedback as well. You guys aren't hearing this, but it's really cool to hear our own voices.
Cool. You can see
Okay.
it.
Thank you all so much. AO videos are up on aosrd.org.
Yeah. It'll be on my YouTube channel as well, Iron Direct Primary Care, and on Instagram, Iron Direct Primary Care. You can find me there.
And also, we have Clearfield Medical Group also is YouTube.
Oh, okay, good.
So yeah, Clearfield Medical Group. We have all of our videos also. And next week, next Thursday, we will be in Reno live, 8 a.m. Pacific time. We are online. It is the congressofmedicalexcellence.com.
Great. Are you going to have the Tuesday show still, or is that
Yep.
closed out? Okay.
Yes, next week we have a local a psychologist, Dennis Williams. He's going to be talking, I think, about ketamine actually.
Oh.
And we actually have a ketamine lecture on Saturday at the conference. Greg Jones, who he's a local ketamine clinic.
Oh,
So
good.
if you want to learn about ketamine, IV and the other forms, Spravato, which is the nose spray form. I got halfway through the course, and I said, I don't know if I want to be doing this. It's you need to do you need to have all sorts of resuscitation equipment and whatnot. I'm getting
Really?
it too long in the tooth.
Oh yeah, the IV stuff is crazy. Yeah.
Yeah,
You're not going to get into that.
Okay. And so those of you who are on here or signed up, if you're coming in person, we can't wait to see you. If you're online, we will be sending out the links. Probably we're doing a run through tomorrow. We'll probably by Friday at the latest. So the online links and everything's going to be recorded. And we will we'll have those available and after the show also. So we have like I said, let me put the agenda up again.
All right. It's past our bedtime. We're signing out. Bye, guys.
Thank you so much. I know it's
Thank
late.
you, Dr. Clearfield.
Back there. Thank you so much. So again, our speakers, we got this guy here, Dr. Nario. Dr. Gerber is our classic homeopath, as is Sean Devlin. Dr. Swedan, she's from A4M. Dr. Gersh, also from A4M. Dr. Schallenberger is the father of ozone in the U.S. Thomas Levy is a classic homeopath. He's coming up from Medellin, Colombia, to speak to us. Pete Dimitri, Air Force pilot. He's going to be speaking on heavy metal toxicity. We all know here Marlene Siegel. She's our integrative veterinarian. Dana Ullman is another classic homeopath. Remember, the second day of the conference is homeopathy. Bill Andrews is an inventor. He's going to be showing us some of his RNA and protein components and telomere work. Dr. Tano is going to be talking about his chronic disease model, and Dr. Burgess will be introducing something called homeopuncture. Dr. James will be talking about bias in AI and bias in medical care. And Dr. Wolf, again, is another classic homeopath. Dr. Zvinia, off the top of my head, you tell me, and Dr. Quinn, you can talk about what they're talking about. Dr. Halassa is going to be in-house, and Dr. Homofarb is a integrative dentist. He'll be talking about the mercury removal and how to do it safely. Chris Kelly is the UNR, University of Nevada, Reno's radon officer. Greg Jones does IV ketamine, and Dr. Ibarra is our spiritual guide. So that's our lineup for next week. Please support us. We need your help. We still have room for sponsors also. And we have some entertainment planned also, and a couple of surprises. So please join us. It's always a Herculean effort to put this together, and we really didn't start. We got a real late start here. We've only been doing this since September. Those of you that are on the committee, I want to see if we can have a short meeting on Friday instead of our usual Saturday, since most everybody's off on Friday. I'll let you know about that. And that's about it. Anybody have any comments or questions? Those of you that are signed up and are coming, Dr. Simmons, Fitzsimmons, thank you so much. And Dr. Berger, I think you're online. Dr. Quinn, of course. So thank you all for your support, those of you that have been with us. And Dr. Nario, what, you have anything to add?
No, just be there. We're just not only going to educate everybody. We have good entertainment. We have food for sure.
Yeah, we got
We
a
have
lot
a
of
lot
food.
of food.
We got
Nobody's going to get hungry.
Yeah, we got a lot of food, so we're going to feed you too. And I have to tell you that last week when I was at AMMG, they didn't have breakfast. They had like a box lunch for they did have some non-CME credits, and they didn't have anything afterwards over. It was like kind of a dud actually. So we're gonna not leave you hanging at least. So okay, Dr. Quinn, you got anything from your end?
No, I think we're good. We had our call last Saturday. We're moving forward, looking forward to the conference.
Okay, good. And I picked up some new hate from my meltdown from last week, I hope. So okay, everybody, thank you so much. And we will see you again next week, same time, same station. We will have Dennis Williams. Like I said, he's a local Reno psychologist. He's going to be talking, I believe, about dissociative disorders and ketamine. So, but it could change. So I'll see you again next week. Dr. Nario, take care. Everybody else, thank you so much. Dr. or Mike Broadwell, thank you for sponsoring us. And we're happy to have you here. And we'll see you again. We've been here, by the way, every Tuesday from October of 2020. We've been doing this. So you can get 2 AMA CME credits. I didn't get the link for Dr. Halassa this time, so I'll send it on. They're always in the weekly newsletter. We'll put them on there, the links, if you want them. Okay. All right, John, you got anything for us?
Everything's beautiful. Thank you.
I got 3 new. Okay, something about JD is a lawyer. Okay. All right, and okay. All right. So good night, everybody. We'll see you next time, same station.
Good night.
Good night.
Good night.